But for now, would love to introduce Francesca Brogan to the group here. And Francesca Brogan, she's a financial advisor at SBC Inc. She has been licensed insurance agent since 1995 and certified by the Centers for Medicare and Medicaid Services since 2008 to educate seniors on their Medicare options. She's also a Medicare broker who works with top carriers in the Northern Illinois area to make sure that her clients are in the best plan that meets their individual needs. Since Medicare is not a one-size-fits-all, it is important to get educated with a Medicare 1010 consultation. That way, you can make an informed decision. She can assist you in putting the pieces of the puzzle together so that you will walk away with peace of mind and an agent that will be there when you need them. So Ms. Francesca Brogan, just want to pass it over to you.
All right, well, thank you. Thanks for that introduction, David. And good afternoon to all. I hope that today finds you all happy, healthy, and safe. So today my goal is to help you put the pieces of the Medicare puzzle together. There's so much information out there, and I can go on and on for hours and hours about Medicare, but really I feel that unless you truly understand the basics and what your choices are, a lot of it just gets too confusing. So if at a later time you would like to work with me, I'd be happy to go over your particular situation with you and to make sure that you are in the right plan that fits your needs. And as David just said, that Medicare obviously is not a one-size-fits-all. What's good for your neighbor may not be the best plan for you. So I am a Medicare broker. I specialize in Medicare plans, and there's no fees for my services. So I work with a lot of the top carriers in your area because a lot of these plans, especially the Medicare Advantage plans, are area specific. So I know what plans are in your area and I help you choose the right one for you. Of course, the decision is always up to you, but I help you to navigate through the system. So let's get started. So first, I think the very first thing we need to do is to differentiate between the different types of plans. Your original Medicare, the plans that come from the government consist of Medicare Part A and Medicare Part B. A is for the hospital insurance and B is for your medical insurance. Everything else that you get comes from a private insurance company. Medicare Part C, which is your Medicare Advantage plan. Those are the like all-in-one types of plans, and I'm going to get into this in more detail on my next slide, but they're HMOs and PPOs and HMO point of service plans. There's all different types of Medicare Advantage plans. Now, Medicare Part D, which is for your prescription drugs, is what you get for to cover your prescription. And even though it's called Medicare Part D, you do not get it from Medicare. You do get it through a private insurance company. And then, of course, the Medicare supplement plans that everyone is probably most familiar with. Another name for them is a Medigap plan. And as I said before, there's plans A through N. So there's many different options there as well. So as you can see how people can get confused because there's different parts and plans, and a lot of times people interchange them, okay? Next slide, please. All right, now looking at this chart here, this is what I feel is the easiest way to explain to you how original Medicare works and what you have basically two different options, two main options. This is what most people do. Let's start at the top here. Your Medicare Part A and B. It's this red, white, and blue card that you see, okay? Medicare Part A is for the hospital. It really helps pay for the hospital stays and inpatient care. It mainly pays for like room and board, okay? Part B is what covers all your medical. That's why you see a stethoscope next to Part B and a bed next to Part A there. So this is what you get from Medicare or the federal government. Everything else is from a private insurance company. So to start with Medicare Part A, let's say you go into the hospital as an inpatient stay. This is whether it's a regular hospital room, a skilled nursing facility. It covers hospice. It does cover some pints of blood if that's needed. But Part A has a deductible. Currently, it's $1,408. Okay. So if you go into the hospital and all you have is original Medicare, all I'm talking about is original Medicare right now with no other insurance yet, you're going to pay that Part A deductible of $1,408. I think that's going up slightly next year, but this is for 2020 right now. And then they go by what's called a 60-day benefit period. So on the day you come out of the hospital, they start counting 60 days. If within that 60-day period, you go back into the hospital, you're satisfied under that first deductible of $1,408. But on day 61 and beyond, if you go back into the hospital, you will owe that Medicare Part A deductible again. So the main point I want you to realize is that it can happen more than once in any one calendar year, okay? Then Medicare Part B is what covers all the medical portion, whether you're inpatient or outpatient. So even in the hospital, your doctors, your surgeons, your anesthesiologists, your MRIs, whatever happens to you while you're in that hospital is all covered under Part B, okay? Part B has a one-time annual deductible of $198, and then Medicare covers 80% and you're responsible for the other 20%. So as you can see, original Medicare does not cover you 100%. You have 2 deductibles and 20% that you're responsible for, and that's why people look into other insurance as well. Now the next step, step 2 here you can see says decide if you need additional coverage, and you have 2 ways to get it. Option 1 is to go with that Medicare supplement or Medigap plan to help fill in the gaps where Medicare leaves off. There's plans A through N. Plan F is the most comprehensive. Now I'm going to talk to you a little bit about Plan F, because if you are currently 65 prior to January 1st of this year, you are always eligible for Plan F. You may have had it and you're grandfathered in. Even if you didn't have Plan F before January 1st of this year and you were 65 before then, you can still get Plan F. Plan F will always be around for those 65 and older before January 1st, 2020. After January 1st of this year, Plan F is no longer available to those turning 65, okay? So let's just go, I just want, for illustrative purposes, I want to explain that if you have Plan F, it covers both deductibles, Part A deductible and Part B deductible, and that 20%. So you virtually would have no out-of-pocket expenses on the medical side. But because Medicare, original Medicare, does not cover your prescription drugs, you know, your ongoing maintenance drugs that you get every month from the drugstore, you have to get what's called the Medicare Part D plan, okay? It's for your prescription drugs. So you get 2 different plans in step 2. The Medigap plan fills in the gaps where Medicare leaves off, and your Part D covers your prescription drugs. Going back to the supplement for a second here, for those of you who turn 65 on January 1st of this year or after, the next best plan available to you is Plan G. It covers everything except for this Part B deductible. So the deductible currently right now is $198, and that's annually. And then Medicare pays the Part A, or I'm sorry, the Plan N pays, Plan G pays the Part A deductible and the other 20%. So that's the next best plan that you can get. We can talk about other plans as well, but we have, you know, not that much time today. So I kind of just want to give you the brief overview. If you want more information, then please contact me in the future. With a, oh, what happened? Sorry. With the Medicare supplement plan, you virtually can go to any doctor anywhere in the country. There is no network. It's not an HMO and it's not a PPO. Now, I know a lot of times people, you know, that I sit down and talk with, they think that a supplement is a PPO because you can go to any doctor, but it's technically not a PPO because a PPO is still a preferred provider organization. And we're going to get into that a little bit more when we talk about option 2, okay? So you can go to any doctor, any hospital that takes Medicare. I'm just going to give you a ballpark figure between these 2 plans. Let's say at the age of 65, it's going to cost you approximately, give or take a few dollars, $150 a month to have this type of coverage that goes along with your original Medicare and supplements what Medicare doesn't pay, okay? Or the other type of plan that you can get is option 2, which is the Medicare Advantage plan, also referred to as Medicare Part C. So again, even though it's called Medicare Part C, it's gotten through a private insurance company. This type of plan combines Part A and B into one convenient plan for you. Many of them include your Part D coverage and gives you some additional things that original Medicare doesn't, such as vision and dental and over-the-counter products and gym memberships and all kinds of nice little perks that a Medicare Advantage plan can give you over and above what original Medicare does. So these types of plans are a lot less expensive. It can be, some of the plans are zero premium. It could be $38, it could be $29, it could be $76. It depends on the plan and the company. And how these types of plans work is you pay a lesser premium per month, but I like to refer to them as a pay-as-you-go plan. So you'll pay predictable co-pays and co-insurance up to what's called a maximum out-of-pocket per year. So instead of with the Medicare supplement and the standalone Part D plan, where you're paying like $150 ballpark a month, it covers most of your out-of-pocket on the medical side. You're still going to have co-pays with Part D, but a Medicare Advantage plan, you pay much less per month and you pay as you go. You pay a simple co-pay. For example, going to see a primary care physician, most of the plans have a zero co-pay. A specialist might cost you anywhere from $30 to $50 a visit, again, depending on the plan. And every service has a copay affiliated with it or associated with it. And then it has, as I said, a maximum out of pocket. So an example of that might be a $3,900 max out of pocket per year. What they do is they add up all your copays throughout the year. If it ever totals $3,900, then you're covered 100% thereafter. Now, I do want to point out that the copays that you're paying for Part D do not go towards that maximum out of pocket. That has its own set of rules, which I'm going to get into in a little bit here. But when you take a look at one of these plans and you see what the predictable copays are, you're going to realize that it would take an awful lot to ever reach that maximum out of pocket. So this is what I do is I sit down with people and I go through your options. I explain to you in much more detail how this Medicare supplement plan works and what the costs are, as well as the standalone Part D, and compare it to the Medicare Advantage plan. And then you decide which is the best way for you. Now, with the Medicare Advantage plan, I will tell you that they are network-based. There's HMOs and PPOs, as I mentioned before. I usually recommend the PPO because they're a little bit less cumbersome. You can go to any doctor still who will take Medicare, but there is a preferred provider organization. So if you go to those doctors, you're going to pay a lesser copay. If you go to a doctor out of network and they do take the plan, you'll pay a slightly higher copay. So, you know, it gives you more flexibility that way. And the nice thing about it is there are no referrals required. And it also gives you a lot of these nice additional value-added perks. But it's totally up to you, whatever way you feel the most comfortable with. And as we do a consultation, we'll figure that out together. Okay, next slide, please. All right, so I do want to talk a little bit about eligibility for Medicare Part C, which is that Medicare Advantage plan. You do have to be enrolled in Medicare Part A and B and continue to pay that Part B premium in order to be eligible to enroll into a plan. There's no pre-existing conditions, so anybody's eligible in that respect, and you have to live in the plan service area. So what does that mean? It means that these plans, these HMOs and PPOs, are in select counties. So they're not in every single county in Illinois, for example, but they're in around here, you know, McHenry County, Kane County, DuPage, Lake, Cook. We have a lot of plans in all of those counties, but maybe down south in rural Illinois, they don't have as many choices. The reason for that is because they need to create a network of doctors and providers. And if they don't have enough doctors or hospitals to participate, it would be very difficult to create one of these plans in those areas. That's why they are service area dependent. So if you live in Kane County, let's just say, for example, McHenry County, and you enroll into a plan that's in that service area and you move to another county downstate Illinois or to Florida or wherever else you want to move to, you will need to get a new plan that's in that service area. Okay, this is all the types of things that I go over with you so that you know exactly what the rules are and how to navigate through the system. Now, there's also some enrollment periods that you need to be aware of. And I'm going to tell you how this works. So initial enrollment period is when you first turn 65. You have a 7-month window to enroll into a Medicare Part D plan. And because the Medicare Advantage plans include Part D, that's also included in that 7-month window. So you have 3 months before your month of your birthday and 3 months after that in which to enroll into a plan. Now, normally when you're turning 65, It kind of depends on whether you're collecting Social Security yet or not. If you are collecting Social Security, they will automatically send you your Medicare card for Parts A and B. Okay. If you're not collecting Social Security and you want those, you have to apply for them. Now, sometimes people are still working and they have their employer plan, so they don't need Part B. So all you would need to enroll into at that point would be Part A. Okay. But in order to get into any of these plans, you need Medicare Part A and B. So if you're going to go into a Medicare supplement plan or a Medigap plan, in order to have this GI, what that stands for is guaranteed issue. In order to have a guaranteed issue when you first turn 65 to get into a Medicare supplement or Medigap plan, you have to enroll within the first 6 months. After that, depending on the company, there could be some underwriting involved. All right. So 6 months on a Medicare supplement plan, 7-month window for Medicare Advantage and Part D plans. That's your initial enrollment period. That's what IEP stands for. After that, there's another enrollment period called SEP, Special Election Period. There's certain situations that give you this time that you can enroll at different times throughout the year. All right, so I'm going to give you some examples. I already mentioned one of them. If you move out of a service area, you move out of state, it gives you a special election period to choose new plans. They have to, because even the Medicare Part D plans are, area dependent, so state dependent. So if you move from Illinois to Florida, you're going to have to get a new Medicare Part D plan as well if you have a standalone plan. Another qualifying event, that's what this QE stands for, is qualifying event, would be if you are on an employer plan. You decided when you turned 65, you were still working and you wanted to keep your employer plan. All you did was apply for Medicare Part A and you delayed Part B. You said, no, I don't want Part B yet because I still have my employer plan. You don't necessarily have to have B with your employer plan because you're still going to have to pay that Part B premium, which, by the way, is $144.60 a month. Again, that's income dependent. So if you're under $85,000 a year as an individual, $170,000 as a married couple filing jointly, that's what the premium is for Part B. And it goes up from there depending on what your income is. So that creates another special election period, though, is if you want to leave employer coverage, whether voluntarily or involuntarily. Maybe you don't work for the company anymore, and once you leave, they don't allow you to keep the plan, or you, whatever the reason is that you're going to leave your employer plan, you can just decide anytime you want, even if you're still working for your employer, that you decide you want to go onto the Medicare plan, that you may feel that might be a better choice for you. You can disenroll from your employer plan and go into, and go ahead and pick up Medicare Part B and enroll into another plan. You have 63 days from losing an employer plan, from moving out of the service area in order to get into another plan, and that's your special election period. Again, when you have an agent like myself, I help you navigate through this system because I know this is a lot of information to remember. AEP is Annual Enrollment Period. That's coming up very quickly here, October 15th through December 7th. This is the time of year, each and every year, that you can make changes to your plans. Just like when you were working for an employer, they usually had an enrollment period, an annual enrollment period when you can make changes to your health insurance. Same thing with Medicare. October 15th through December 7th. You can change, if you have a supplement in a standalone prescription drug plan, you can change to a Medicare Advantage plan. If you have a Medicare Advantage plan, you can go back to a standalone Part D plan and pick up a supplement. Okay, you can make any kind of change that you want during this time. And by the way, just so that you know, annual enrollment period really is geared toward Medicare Part D, the prescription drug plan. And because the Advantage plans, a lot of them, most of them have Part D included in it, they're also subject to this annual enrollment period. But with a Medicare supplement plan, I don't know if you know this or not, for those of you who may already be on Medicare, you can change those plans at any time throughout the year. So a supplement plan, you can shop it, you can, compare prices with other companies anytime that you want and make that change anytime that you want. Usually takes effect on the first of a month. With Medicare plans, they're just, again, I would like to mention that they are standardized through Medicare. So a Plan G is the same Plan G with no matter what company you go with. The things you want to look at when you're comparing supplement plans is price. What is the rate? What's the rate today when you join? What's their underwriting rules? Because not all companies do their underwriting the same way. And what are the rate increases like? What's their historic rate increases like? So there's a couple things to evaluate, not just what the price is today. You got to think about the future and what is it going to be, okay? Then another enrollment period is the OEP, that's open enrollment period. They brought this back about 2 years ago, and it's January 1st through March 31st. What this period gives you is a chance to change your Medicare Advantage plan. So if you're currently in a Medicare Advantage plan on January 1st and you want to change to a different Medicare Advantage plan, you can do so up through March 31st. You can also drop that Medicare Advantage plan, go back to a standalone prescription drug plan and pick up a supplement, but you cannot, the thing that you cannot do during open enrollment period, OEP, is to change your standalone prescription drug plan and get into a Medicare Advantage plan. So it really is only for those people who currently, at that time, January 1st, have a Medicare Advantage plan and want to make changes to it, okay? So let's talk a little bit about prescription drug coverage if you want to change the slide. Thank you. These are some things to know about how Medicare Part D works. There are 4 drug payment stages. First, you have an annual deductible. Not all plans have it. Some plans only have it on certain tiers. So for instance, there's 5 tiers usually, tier 1 through tier 5. And a lot of times plans will just have a deductible on the higher, you know, tier 3, 4, and 5, or only tier 4 and 5. Some plans have deductibles all the way through. It just depends on the company and the plan. Each company even has, you know, multiple plans to choose from. So if the plan that you choose has an annual deductible, you have to pay that first before the plan will pay its share. Then the next stage is what's called the initial coverage stage. This is when you're going to pay co-pays until the retail cost reach, the boxes are covering my numbers right there. I believe it's 4,000, I can't see it. Hold on, let me look it up.
4,020?
4,020. I don't have those numbers memorized yet because they're brand new for 2021, okay? Oh, you know what? I have the wrong year on there too. It says in 2020. It's supposed to be 2021. Okay. So at any rate, you're going to pay co-pays until the total retail value reaches that number. And what I mean by total retail cost is it's what you're going to pay in your co-pay plus what the plan's paying on your behalf. So just a quick, simple example is if you have a generic drug that costs $25 a month retail value, and this is the negotiated retail value that that plan is negotiated, and you're going to pay a $3 copay, the plan's going to pay $22 on your behalf. The total retail value, though, is $25. So they're going to add up that total retail value. Once it reaches that $4,020, then you are going to go into what they call the coverage gap or the donut hole. A lot of people know it as the donut hole. This is where you're going to pay 25% of the brand names and your generics until your total out-of-pocket reaches $6,350 in 2021. That should say, typo again. So you're going to pay more while you're in the donut hole. Now, let me just continue with this line of thought here first. Once you reach that amount, then you go into what's called catastrophic coverage, and you're going to pay smaller co-pays or co-insurance for the remainder of the year. They're very small co-pays. For example, you're going to pay $3.70 for a generic, $9.20 for a brand name, or 5%, whichever is higher, okay, for the rest of the year. Now, these are the standard rules for Medicare Part D and how it works, the different coverage stages. I do want to point out that there are different exceptions. There's always exceptions to all the rules, right? So if you get what's called extra help paying for your drug coverage, it's a federal program that you can apply for if your income is below a certain threshold that gives you extra help. If you get that, it's going to help you pay for part of the premium or maybe all of the premium on your Part D plan. It's going to give you lower copays from the start, even in the initial coverage stage. And it's going to give you coverage through the donut hole, meaning you're not going to be subject to that 25%. Okay. So there's different exceptions to everything, just so that you know that. And by the way, as long as I'm talking about that extra help, something else I want to point out about Medicare Part D. If you do not enroll into a Medicare Part D plan when you're first eligible, either by turning 65 or losing employer coverage, you may be subject to a late enrollment penalty. I think that might even be on my next slide. If you want to go to the next slide, please. Maybe, maybe not. At any rate, if you don't get a plan when you're first eligible, they're going to charge you a late enrollment penalty. So let's say, just a simple example, you turn 65 and you want to get a supplement plan, but you don't take any prescription drugs as of right now. And you think, why should I get a Medicare Part D plan and pay an extra premium of $20, $30, $40 a month when I don't even take any prescriptions? Well, the thing I can tell you is if you don't take a plan when you're first eligible, and then you want to get one 5 years down the road, they're going to charge you a late enrollment penalty of 1% per month for every month you did not have a plan. So 12 months times 5 is 60 months times 1% of the national average cost of a drug plan, which currently is about 34 cents a month right now. You're looking at, you know, $4 or $5 whatever dollars penalty, but that's going to be, actually, what am I saying? It's going to be more like $20 or more penalty. I don't know, and Medicare figures that out for you. Believe me, they will let you know what it is. And they're going to tack that onto the cost of any drug plan that you choose in the future. And it's per month. It's not a one-time penalty. It's a per month penalty that they're going to tack on every month that you hadn't had a drug plan, and it's going to be forever. So as long as you have a Medicare Part D plan, they're going to charge you that penalty per month. So that's another thing to keep in mind. Now, some more things to know about Medicare, how Medicare Part D works. Each plan has a different, network for pharmacies and has a different formulary. So again, there's a lot to know about choosing a Medicare Part D plan. Another good reason to have an agent, because I can help you look all of this up, all of your drugs. I can check all the different formularies and see which is the best plan for you. You need to know what tiers your drug falls into. As I mentioned before, there's 5 different tiers. Tier 1, Tier 2 are usually your generics. Tier 1 is your lower cost generic. Tier 2 is a higher cost generic. Tier 3 is your brand name, and Tier 4 is, let me back up. Tier 3 is a preferred brand name, and Tier 4 is a non-preferred brand name, and Tier 5 is a specialty drug. Those are the most expensive drugs for, like, chemo and cancers and MS and the more expensive drugs, of course. Step therapy is something that a plan might ask you to do. So if you're taking a Tier 4 drug, let's say, they might come back and say, try taking the generic first. You may have already tried that and you already know that that doesn't work for you, and that's why you're taking the Tier 4. You can have your doctor ask for an exception and get a decision within 72 hours. If they grant you that exception, it'll probably be at a Tier 3 or Tier 4 level, depending on the plan. Okay, so even if it's not covered on a formulary, you can ask for exceptions. There's also quantity limits that may apply, obviously, to ensure that the safe and effective use of the drug. And prior authorization may be required to ensure that the drug is being used for the condition covered by, used for the right condition covered by Medicare. So there's all kinds of little things you need to know about Medicare Part D and how that works as well. So I've covered a lot of ground here. I know you probably have some questions, but if you can go to the next slide, please, let me see what. Yep, this is the Clarity Workbook. This is a nice little pamphlet. It is put out by United Healthcare. I like it because it has all of this information in there that I just went over and more, okay? Even though it says United Healthcare on there, remember, I am a broker. I do work with other companies. I just feel that this is a great little pamphlet with a lot of nice information in there. If you would like one of these pamphlets, please email me. My email is fbrogan@comcast.net. Or you can also call me. My phone number is 248-0705. And I'll be happy to get one of these books for you. I can email you a PDF of it. I can mail you a copy in the mail. And as soon as the new one comes out for 2021, which won't be until October, I can get you one of those as well. Okay. I'll also email you a nice little brochure on myself that gives you a little bit of my bio, my background, some information about what I do and my contact information. So I think that's basically what I wanted to share with you. If we want to go back to one of the first slides that has that diagram. Yep. Next. Yep, that one right there. This is the best diagram here to help you, I think, in your mind, visually understand how Medicare works. You got your original Medicare, Part A and B, doesn't cover everything. So then you look at option 1 or option 2, which is the best way for you to go. A Medicare supplement plan is going to be a little bit more expensive, but it gives you the flexibility to go to any doctor, any hospital in the country that takes Medicare. And depending on which plan you choose there, it supplements or fills in the gaps with Medicare Part A and B. And then you get your Part D standalone plan. Or you get your Medicare Advantage plan, which is less expensive per month, but pay as you go. So let's say you don't go to the doctor very often. You may be better served with a Medicare Advantage plan. Plus it gives you a lot of these extra nice little perks. It just depends on your situation. That's why I always say Medicare is not a one size fits all. Everybody's situation is different. And I really like to, get to know you a little bit and know what your situation is before we can do a deeper dive into either option here. But again, totally up to you. So now I think I'm going to open it up to questions.
I have them for you. I have questions from people. I can read them to you.
Okay.
They've been coming in all along, and what an informative, wonderful presentation. And Terry Ebner had asked, is there a Medigap that travels with you if you move without going through underwriting?
Yes.
Or move to another state?
Yes. So great question. Medicare supplement plans do move with you. Unlike a Medicare Advantage plan, which is dependent on the service area, you can use that Medicare supplement plan anywhere. So if you move to Florida, you can take the same supplement with you and it works in Florida just like it works anywhere else. You do not have to get a new plan. Now, the rates might be slightly different because each state determines their supplements rates, okay? They have to be approved by the state. So the rates may change a little bit, but yes, you can definitely take that plan with you.
What if you decide to travel after 65?
What if you decide to travel? Well, depending on what plan you have, most of them cover you are you talking foreign travel or within the country?
I'm not sure. Laura, did you want to
Okay.
specify? She had a specific question. Just
Well, I'll just cover both. Okay, as I said, the supplement covers you anywhere. So if you're on vacation anywhere else in the country, no problem. There are certain plans within supplements, Plan F, Plan N, Plan G, that have foreign travel coverage. So if you're outside of the country, they do have some coverage. It has a deductible of $250, and then it covers you up to $50,000, where it pays 80% and you're responsible for the other 20%. Okay. With a Medicare Advantage plan, it has worldwide emergency coverage with usually a $90 copay. Okay. So no matter where you are in the world, you have access to emergency coverage with those Medicare Advantage plans. So yes, you do have coverage while you travel.
Is it better to have a G plan or teacher retirement service for which I will be eligible to apply in October?
Better to have a G plan or a teacher retirement plan? Is that the question?
That's the
Okay.
question. This person will be eligible in October.
Okay. I would need to know a little bit more about your teacher plan, but usually those plans are pretty robust and pretty good. So, that's something that it would be best answered if I could have a little bit more information, because it's hard for me to say without knowing what it entails.
Okay, well, Basim, you probably could just email Francesca for something specific and talk to her about that. Another question, if you take no prescription drugs, can you not take D and use a prescription app like GoodRx when needed?
Yes, you can. It's an option, obviously. Medicare Part D is not mandatory. You do not have to take it. But as I went over a little bit just a few minutes ago, is that if you don't take Medicare Part D when you're first eligible, either by turning 65, you're going on to, one of these Medicare plans, Part A, Part B, and option 1 or option 2. If you don't take a Medicare Part D, you're going to be subject to a late enrollment penalty down the road if you ever want to enroll into one later. Okay, that was that 1% per month I was talking about. So it is an option. You do not have to take Medicare Part D, but just know that down the road, when and if you want to get into a Part D plan, you will owe a penalty.
Okay. Will an undocumented person who has end-stage renal disease qualify for Medicare?
Well, end-stage renal disease, that used to be a knockout on the Medicare Advantage plans. This coming year for 2021, they've removed that. So even somebody who has end-stage renal disease can get into a Medicare Advantage plan. Some of the supplements, that was a knockout as well. There are some that it's not. So it depends on the company and the plan. And we'll have to see what's coming for 2021 if they're going to remove that as well.
Okay, this states that it's an undocumented person. Does that make a difference?
If they're not a citizen and haven't worked in the United States for 4 quarters, yes, it could impact.
Okay. Annually, can I change between option 1 and option 2 on your first chart?
Yes, yes. So that's what that annual enrollment period is all about. That's October 15th through December 7th. That's the time of year, each and every year, that you can choose completely different options. You can do whatever you want during that time frame. Change to whatever type of plan that you'd like. Okay.
What is the percentage breakdown of your clients choosing traditional Medicare versus Medicare Advantage?
Oh gosh, I've been doing this for about 12 years now. I've been an insurance agent for a long time, but specializing specifically in Medicare for 12 years. I'd say in the very beginning, the first half of my career with this, it was about a 50-50 split. Now I'd say more people are taking the Medicare Advantage plan.
Okay.
People still take the other one as well.
What is the cost of Plan G?
It depends on each different company. So I can't quote you right now because there's too many different options, too many different companies.
Okay.
I'm going to say a ballpark around 120 a month. I'm not without looking it up.
That's a good ballpark. And Debbie wrote, thank you for the wonderful information. I have an interest in becoming a Medicare broker and to also be a supplemental insurance consultant. How would I get started?
Oh gosh, you'd have to contact one of the carriers. I could probably get you in touch with one of the managers in the areas.
Okay, great. And your email is in the chat here. Kathy asked, is there a fee to use your service?
No, good question. So the way I get paid is if you become a member of mine or a client and I enroll you into a plan, whichever company I enroll you into, they pay me a commission. So there is no charge for my services. It doesn't cost you, the client, anything. And you're not going to be charged more for using me either from the insurance company.